Hey guys, today we're going to go over 4 common causes of lateral hip pain, and I'm going to talk about some ways that I've seen people have amazing results to combat their lateral hip pain and get back to running and doing what they love with confidence and comfort. And if you haven't met, hi, I'm Dr. Sarah the Hip Doc. I'm a running coach and a doctor of physical therapy, and truly my mission on this earth is to help women runners with hip pain get back to running again with confidence and comfort. Before we get into the common causes and also some helpful things for lateral hip pain, we really have to consider that there's a lot of things going in and around the hip. So your one Google search that told you that you have hip bursitis might not actually be true. Let's think about all the structures that are there. We have our muscles, so we have our glute med and our glute mid that are attaching into the lateral hip. We have some lateral hip rotators that kind of run this span that attach into the lateral aspect of our hip. We have these little bursas, which are little fluid-filled sacs that increase space and decrease the compressional aspects onto our hip. I like to think of bursas as like packing peanuts. When we're like packing a box, those packing peanuts or those bursas kind of bolster up the muscles and they can become compressed over time. So that's muscle, that's bursa. We also have different neural systems that kind of run through the lateral aspect of the hip. A lot of the ones on the lateral portion of the hip are more sensory nerves, so that's kind of just something interesting. However, we do have other neural structures that can refer into the lateral hip. Specifically, if we go into our lumbar spine and we go up to like L1, L2, L3, those ones can actually refer and wrap around laterally, and we can have some structures from the low back like our nerve, like our disc, or even like these little joints that can kind of refer and cause us to have hip pain into the lateral hip, and it's really referred pain from those distributions. So those are things we have to think about. We also want to think about our vascular systems, ensuring that there's nothing crazy going on vascularly into the lateral hip. We have ligaments, we have our capsule, we have our bone, we have our joint. So it's really important that if you're dealing with lateral hip pain, that you really get it checked out by an expert, because there's so many different things that could be going on, and it's going to allow you to get to the root cause fastest and therefore get better faster. Okay, cause number 1 of lateral hip pain could be habitual compression. And you could say, Sarah, what in the heck is habitual compression? Habitual compression is when we're causing increased compression to the lateral portion of our hip by things that we're just doing throughout the day. So stick with me on this. I know you guys probably have a side that you, especially us gals, we probably have a side that we tend to stand like this. It's I always stand on my right side like this. You can even imagine, you can see in my skirt here that there's increased tension going through the lateral aspect of my skirt. Only imagine what's happening at the hip. If we have those muscles that are spanning over the lateral portion of the hip, we're just increasing tension and we're smushing those packing peanuts or those bursas that are underneath the hip all throughout the day. Another common one is if you tend to sit at a desk or you're driving or whatever, you might tend to sit cross-legged. So we're getting increased wind up or compression through the lateral aspect of the hip that way. Or if you're a person that sits at your desk or whatever, some people tend to sit knock-kneed. And we're also imagining that there's increased compression throughout the outer portion of your hip. A simple solution that you can try to do to solve this problem is play opposite day. So if you're always standing and you're talking to your friends, hey guys, like this, maybe think of shifting to the opposite side. If you always cross your leg right over left, make sure of thinking to the opposite side. If you're sitting at your desk and you always tend to sit knock-kneed, maybe there's something that you even place in between your legs, or maybe you're kind of like the crazy person who puts a band around your knees and then you just kind of, it's a cue for you to gently create tension through the outside of your hip as you're going throughout your day. Making these little changes can honestly make a really, really big difference in experiencing some of your lateral hip pain. Right. If you feel like, yes, that one is me, and you want some more tips on that, feel free to read the caption below, and my 6 ways to ease hip pain actually talks a lot about changing habitual things to make it a big difference in your hip pain. All right, number 2 is mechanical compression. So mechanical compression is similar to habitual compression, where there is going to be compression to the lateral portion of the hip, maybe with something like hip drop or like over rotation, where we're just getting increased tension or wind up. So those structures are having a lot of compression, there's having a lot of tension and load. through the muscle, through the tendon, all of that stuff. However, this is going to be with mechanical load. So for my runners, for my walkers, for my hikers, maybe for you, once you get on a single leg and you're holding it there, maybe immediately you drop into that hip drop, or which causes that increased compression, or maybe after a certain period of time, so you get on mile 2, mile 3, mile 10, whatever, maybe that's when you start to break down and you're actually starting to get increased lateral hip pain at mile 5 or mile 2 or whatever, because for the first 2 miles, you're able to go like this, you're running, you're doing awesome, but then once your hip gets fatigued, maybe you're really dropping and really ringing into that hip. So when you finish it, you're like, oh, the lateral part of my hip is so freaking sore and this is really uncomfortable. My solution for people like yourself is to work on single leg activities really with a mindset of keeping that nice and neutral pelvis. So if I'm gonna drop into something like a single leg squat, if I actually tend to have some hip drop or have my knee dive in as I'm going through that, I'm really gonna focus on not letting any of those things happen and dropping into a single leg squat with no knee diving in and a nice and neutral pelvis. A great way that I like to do this with my clients or with my athletes is instead of having them do something like a single leg squat, maybe where they're unsuccessful and their knee is diving in and they're getting all this drop, I'll just have them put their other foot down. So we're doing that same motion and then they're able to practice that single leg exercise via a lunge, a single leg squat, whatever it is. And they're able to do that successfully. I'll have them do maybe 3 sets of 20, so we're really training up the endurance around the hip. And then this is the most important thing. If you are a runner, we need to train up to the level of running. So we don't need to just be able to stand on a single leg, squat on a single leg. We need to be able to hop and jump on a single leg and continuously have good control with that plyometric landing. So every time we're landing, our hip can maintain that load and not drop and then wring out the lateral side of our hip. If you're like, Sarah, nothing has ever been more true. Come on in to the Empowered Runners Club. You can do a 2-week free trial. You can check out our hip stability series. We actually walk through this whole thing, starting double leg. We really work on glute control and recruitment, and then we progress you to a single leg where you're feeling really strong and confident in all aspects over that hip, and then you can progress into some of our higher level programs that are gonna get you to hopping, jumping, all that stuff to prepare you best for running. Check the caption below for that. Number 3 is hormonal changes. I'm really talking to my ladies on this one. During your menstrual cycle, this is gonna be different for everybody because people tend to have a different response to their hormonal changes while they are menstruating. However, during different phases, you can actually get stiffening of your tissues, or your tissues just feeling not as like pliable and elastic, and you can actually have increased pain into the hip during those phases and cycles. What I recommend during that is definitely working with a physical therapist and figuring out, okay, what do I do during this phase of my cycle? Do I have to do some internal release work? Do I have to do some external mobilization? That is a little bit more kind of dependent on person to person. But the second thing about hormonal changes, this is really for any woman who's in the perimenopausal phase or is going through or has gone through menopause. Once we start to enter that perimenopausal phase, we start to have changes in our hormone fluctuations, and over time this actually decreases the elasticity. So the elasticity is like, think of a rubber band, how it like stretches and then comes back in, stretches and then comes back in. We decrease the elasticity of our muscles and our tendons become less resilient. This is really important for the lateral hip because we have so many of those gluteal tendon groups that are attaching into the lateral hip. Specifically, women that are going through perimenopause actually tend to have a little bit more hip pain, especially if they've had issues in the past during this phase of life because of that stiffening or that decrease in elasticity of the muscles over time. We also see decrease in resilience of the tendons to loads like that we need for running and for our day-to-day life. So the biggest thing that you can do to combat this is to strength train. So strength training is going to take that muscle. So let's imagine that we're talking about like the gluteal muscle groups, but we'll look at it in my bicep, it's going to take that muscle, it's going to take it through its full range of motion and then cause it to come back. That's going to cause that muscle to become very elastic. It's going to increase the elasticity and the resilience through its full range of motion and then make it become stronger as it's going through that coming in motion. Working on strength training is going to be awesome for the muscle. It's going to be awesome to increase the resilience of the tendon. Now, if you're a runner, this is really specific, so listen up. If you're a runner, we actually want to train our tendons and muscles to the demands of running. So maybe not just simple strength training where we're doing like loading like this and this, or like this and this, and we're going through the eccentric and concentric motions, but it's also really important for us to work on plyometric. So we want to do stuff like jump squats, we want to do skater hops from side to side to ensure that our muscles and our tendons are trained up to that level of elasticity. So when we go to run our 2 miles, 4 miles, 10 miles, 20 miles, whatever, they're not like, oh my gosh, I've never done that before. It's really, really important to have a comprehensive training program. If you're like, Sarah, this is me, I'm a runner, I need help with this, you can also join the Empowered Runners Club and practice the full body strength series. We have strength work, we have plyometric work, and a full body capacity for gals who want to run nice and strong. Okay, the fourth common cause of lateral hip pain. This is a sneaky one. Again, it could be something that's coming from the low back, or it could be both. And so like I said earlier, if we're looking at the spinal segments here, this is our sacrum, this is L5, this is L4, L3, L2, L1, and then we're gonna go into the T's. So we're gonna go into the thoracic spine, so we'll go T12. Really from like T12 to L3, we can see that the distribution of where the nerves innervate and where we get sensation and reflexes and all those good things actually wrap around from the low back and actually wrap around and come into the lateral hip. This is like a mind-blowing thing for people where potentially like I could do something at their low back, so maybe I'm wiggling a segment at their low back or compressing it, and they're actually getting a reproduction of their lateral hip pain. So I think it's important to consider that if we are having lateral hip pain, it could be something coming from the low back, it could be something coming from the hip specifically, or it could be both. I actually have a girlfriend who got an ultrasound. So we were in physical therapy school and we were doing like the ultrasound lab, and we were kind of over her glute med tendon, and she had a lot of lateral hip pain, and we actually found a small tear in her glute med tendon. And so she started doing some rehab type stuff for this, and her lateral hip pain actually never got better, even though her imaging said that she had a glute med tendon tear, which was right in this region. She actually went to a really awesome physical therapist. We were like, second year of PT school, so she went to a PT who was graduated and did amazing. And this PT actually started looking at different areas of her spine and different areas of her low back. And when she started doing specific treatment for her low back, her lateral hip pain actually got a lot better, even though she still had that tear on imaging. Because you best believe we were in there with the ultrasound wand, just kind of making sure that things were progressing or seeing if it was still there. So I think it's really important to consider that if you are having lateral hip pain and you're not getting better, again, checking in with your medical provider and seeing, are you attacking this from all the different angles to get the results that you need. I hope you guys found this video helpful and there were some helpful resources that you're able to take from this. If you guys found this helpful, feel free to share it to any of your friends that have been going through lateral hip pain. Also be sure to subscribe. Every other Monday, I will be dropping new videos all about hips, all about running, and all about helping you. If you guys want to see anything specific, let me know in the comments below, and I love hanging out with y'all.